Hi, it's Dr. Lamia Gabal, and I am here today to chat with you about a very common urologic condition that we treat as urologists, and urogynecologists also treat this condition. It's pelvic organ prolapse. And many women are unaware that there are certain things that can fall out of the vagina, including your bladder, your rectum, your uterus if you still have it, or even the small intestines that can come down, especially after a hysterectomy. So when the bladder drops out of the vagina, it's called a cystocele. When the rectum drops out of the vagina, it's called a rectocele. When the uterus drops, we call that uterine prolapse or uterine descent. And then if we find that the small intestines are coming down, that could be an enterocele. So these are very common to find on pelvic exam. There's a higher risk of having pelvic organ prolapse with genetics. It does tend to run in families with a higher number of pregnancies or vaginal deliveries. There's increased risk for things falling out of the vagina. We can blame our kids for so many things, but this is definitely one of the things that we can blame our kids for. And then also heavier weight, obesity can increase the risk for things falling out. And then heavy lifting on a repeated basis, we have seen also pushes things out. So not on a daily basis, but if someone is a UPS driver or a weightlifter as a trade, then that could increase the risk for things kind of falling out of the vagina. The symptoms vary from person to person, from woman to woman, and some women who have very high degree of prolapse, they may have no symptoms and no bother. Other women may have leakage of urine or leakage of stools, or even constipation could be a symptom. Recurrent urinary tract infections can be associated with prolapse because you don't empty your bladder and your bowels completely. You may have a feeling of bulge and pressure, that something's, kind of like a baby's head, something's falling out of the vagina. So those are some of the more common symptoms that are associated with pelvic organ prolapse. And the treatment options range from possibly doing nothing if it's not bothering you and there's no complications. There's a device called a pessary, which is a plastic little ring that we can fit you with that goes inside the vagina to push everything in place. And there's also surgical options that can help replace the normal anatomy back to its normal anatomical position. So again, this is one of the most common things that I treat in my practice. That is my subspecialty, is female pelvic medicine and reconstructive surgery. And no matter what your symptoms are with this, you should not be embarrassed to talk to us about it, because it is so common, even though a lot of women don't know about it and they're horrified sometimes when I ask them if there's certain things that they do in order to empty their bladder and bowels. But it's a very common thing that we see, and we can help you with it. So don't be embarrassed to chat with us about it.